which is a faster recovery, the anterior approach or the posterior approach for total hip replacement surgeries? Hello, I'm Bernard Kemper at Carolina Regional Orthopedics, and today I'm going to talk to you about recovery rates after total hip replacement. An anterior hip replacement surgery is often called a muscle-friendly or a muscle-sparing approach, as you don't cut the muscles. This does allow for more quick rehabilitation, and most of my patients within 2 to 6 weeks are back to walking without a cane or a walker and are driving. While the posterior hip replacement is a fine way to do a total hip arthroplasty, and in some select patients may be the preferred way, the recovery is slightly slower. This is because the posterior hip approach, you have larger muscles on the backside of your hip, and they do have to be cut or split in order to get to the hip capsule and the hip joint to do the surgery. In doing so, the hip replacements from the posterior approach take about 6 to 12 weeks before they're comfortable without a cane, walker, or driving. Of course, this is patient dependent, but this has also been supported by many orthopedic research studies and in my own personal experience. If you'd like to come and talk to me more about which hip approach is quicker recovery for you specifically, I'm more than happy to evaluate you at Carolina Regional Orthopedics.